must be Michael. I'm feeling a little fixation right here. The spine, the cervical, the thoracic, or lumbar, and this.
There's no one like Dr. Butt.
We're gonna give it a little bit here. Let me just check. Oh yeah, that's the way I like it.
Wow.
Welcome to Ask Dr. Bud. I'm Dr. Bud, and today we're going to be talking about tennis elbow and golfer's elbow, which are very, very typical elbow problems that are overuse syndromes. My model here is going to show me so we can demonstrate the problem. In a golfer's elbow, it's called medial epicondylitis, which is the inside of your elbow, and it'll generally be tender and or swollen right here where the flexor tendons of the wrist attach, and it'll be just really ouchy right there. And you'll be able to just touch it with your own opposite hand, and it'll be very, very tender. This is when a golfer is following through on a golf stroke, maybe hit the ball too hard or he has bad technique. It can also occur from a carpenter that's using a hammer, a painter that's painting repetitively, that's a weekend warrior painter that doesn't do it for a living, and that can cause this medial epicondylitis, as we call it. Now, tennis elbow is typically this outer side. These are the extensor tendons, the tendons that make your wrist go like this. And so when you're using a backhand in tennis and your strings on your racket are not strung right or you have poor technique, you'll begin getting wear and tear right there on the edge of the elbow. And it'll be very, very tender. It'll hurt when you shake hands with people, so you'll avoid shaking hands with people, especially now with COVID. You're not shaking hands anyway. But if you were, you'd be feeling it right here if you had tennis elbow. So this is when the tendon is actually pulling away from the bone. It gets very, very chronic. There's these little fibers called Sharpie's fibers. They get inflamed. They're starting to pull away from the bone. So this needs to be rested. A lot of times we put like a little band around here called a tennis elbow support, which shouldn't be elastic. It should be firm. We use ice massage, ultrasound, manipulation to break loose the scar tissue here, both to the medial and lateral side. And it can usually, if you rest it and you ice massage it and lay off the activity for a month or so, you can generally get better on your own. But if you try to push through it, you're going to end up getting treated by somebody. And if it gets bad enough, it sometimes even occasionally needs surgery. But usually deep tissue vibration, deep tissue myofascial release therapy, ice, the brace, we can usually knock out about 90-95% of these without any intervention at all. So thanks for tuning in to Ask Dr. Bud about tennis elbow and golfer's elbow.